Hello everyone, and welcome back to my Occupational Therapy Doctoral Capstone mini-series. In this episode, I will be talking about carpal tunnel syndrome and wrist pain. Firstly, what is carpal tunnel syndrome? Well, carpal tunnel syndrome is inflammation of the median nerve, a nerve that passes through the carpal ligament, which is that bridge you see horizontally across the wrist. Carpal tunnel is incredibly common during pregnancy because the body naturally retains more water. This can lead to swelling of the appendages, so that's where you get the ankle and feet swelling, and you get the swelling of your hands and your fingers. Since the body retains more water and causes swelling during pregnancy, the carpal tunnel itself can become inflamed. Carpal tunnel syndrome is caused by excessive repeated movements into flexion or extension of the wrist. During pregnancy, because the body retains more water and causes swelling internally, normal everyday movements that you do that are rather repetitive are more likely to cause carpal tunnel than outside of pregnancy. Now, after pregnancy, carpal tunnel is still a pretty common complaint because the movements that you're having to do with an infant or a toddler are a little bit outside of the norm of what we typically do in a day. For some, the process of breastfeeding can lead to carpal tunnel symptoms. Sometimes your wrists can end up in very awkward positions during breastfeeding to ensure that the baby is in the proper position for successful latching and feeding. Sometimes you have baby's head in your hand and your wrist is excessively in flexion to make sure that their head is supported. Sometimes even if baby's head is in your elbow, your wrist can end up in either excessive flexion with holding their bottom, or as they get a little bit bigger, you can end up in extension as you're supporting their weight. Now, doing this for short periods of time isn't going to be cause for concern, but sometimes if you end up in this position for a long period of time, especially if you are the parent to multiples, you're going to be in these awkward positions for longer periods of time, very consistently, and that can lead to feelings of carpal tunnel symptoms. Now, what can you do to remedy this or even stop it from occurring at all? Well, there are breastfeeding pillows on the market. For example, you've got the Breast Friend and the Boppy. Those pillows provide a horizontal support for the baby to be rested on to take some of the strain off of your arms. Now, if you don't want to purchase a breastfeeding pillow, you can use pillows or blankets that you already own. I've got a big couch pillow right here. You can have the pillow on your lap. I don't have a baby, but I do have a cat. You can use a pillow that you already have in your house, and you can support their bottom with your elbow instead of using your wrist, because if you can see, my wrist is in flexion. And if I have to hold that position for a while, that's going to start being irritating. So I can support the bottom with my elbow, and I can support the rest of their body with my wrist in a neutral position. Now, for the head, you can shift the pillow so it's facing more upright, or you can use a separate pillow to be underneath to raise baby up a little bit so that their head is at about your breast height, so that then you can get them to latch and feed without having to strain your wrists in either flexion or extension. He is unfazed by most things, so I appreciate him for being my model of a baby. So this is one way that you can position the baby on your lap, but remember, if you have lumbar or lumbopelvic pain, if you want to support their head with your wrist to make sure that they're in the proper position, it's important to use a lumbar support on the couch so that you and baby aren't just leaning back and you're not in that posterior pelvic tilt. If you do have carpal tunnel symptoms, the best way to remediate it non-surgically is going to be through keeping a neutral position of your wrist and reducing the occurrence of those repetitive movements. When you're sitting and relaxing, if you can keep your wrist in a neutral position and slightly elevated through using a pillow or a blanket, that neutral position is going to help to reduce the swelling of the wrist because you're not excessively in extension or flexion, and keeping it slightly elevated is going to reduce the occurrence of the swelling simply through blood flow. Additionally, you can use ice because ice is a vasoconstrictor, which means that it makes the blood vessels smaller, it makes them constrict, and that reduces inflammation. Now, with using ice, the recommendation is no more than 20 minutes, and you're going to experience the following 4 stages of using ice. You're going to feel cold, burning, aching, and numb. The ice has reached maximum efficacy once you're in that numb stage. So you can take the ice away and just let yourself have that cold feeling without the ice actually on it. Give yourself a break of about 20 to 30 minutes before you re-ice. Elevation, resting in neutral, reducing the occurrence of those repetitive flexion or extension movements, and icing can be effective in reducing carpal tunnel symptoms without surgical intervention. Now, if carpal tunnel does become severe and it becomes debilitating, please reach out to your physician to get a consultation for either in-person occupational therapy with a hand therapist, or you may need surgical intervention. Remember, the best way to remediate carpal tunnel symptoms is to keep your wrist in a neutral position, not extended and not flexed. While you're sleeping, supporting it and keeping it in a slightly elevated position is going to be very important. For example, if you are a side sleeper, one of the best things to do is have a little tiny blanket or a towel next to your pillow. I've got a little blanket right here. I'm going to fold it and then fold it into what would be thirds if I went all the way. But that 1/3 fold is going to create a little bit of elevation. If I'm a side sleeper, I can rest my arm with my elbow on the mattress, my forearm on the incline, and my hand up at the top of the blanket. Now, what this does is it supports my wrist in that neutral position, and it provides slight elevation for my wrist as I'm sleeping on my side. If you sleep on your back, you can do a very similar thing. Take that same blanket or towel, have that slight incline where again your elbow is resting on the mattress, your forearm is going up the incline, and your hand is at the very top. Now you can do this one of 2 ways. You can either have your fingers also extended into that neutral position, or if it's more comfortable, you can have your palm at the end so that your fingers can kind of roll down and be slightly closed around the blanket or towel. This is again supporting you in that neutral position and providing a little bit of elevation. If this is uncomfortable and you typically sleep like this, again, if you look at my hand, I'm in flexion. But using the same technique, same 1/3 fold, place your elbow on the mattress, forearm on the incline, and your palm at the top with your fingers rolling over. Of course, these are not 100% guaranteed to work all night, every night. If you do wake up and you're in that flexion position, just take a second to kind of reset into that neutral position and just start over. It's okay. We can't control what we're doing when we're unconscious. So just take a second to put yourself back in the correct posture to reduce the inflammation.